Hi, my name is Oluwatoyin Genevieve Ogunwumi, and today's date is May 29th, 2021. So my medical biochemistry course, this is unit 4 case connection, and I work on case 1 and 3. So case 1 is about a newborn girl which appeared normal at birth, but within 24 hours she developed lethargy, hypothermia, and apnea. The attending physician suspects a metabolic disorder and order a panel of lab test. So a full blood work was ordered for this female, and it shows that the ammonia level was high and rapidly rose. So I'm gonna discuss the normal mechanism of ammonia transfer in the body that should be occurring, including the glutamate dehydrogenase, glutaminase, and glutamine synthesis. I'm going to also discuss the role of transamination. So how ammonia is processed in the body is ammonia is produced in the gastrointestinal tract in the body that diffuses through the mucosa in the intestine. So, and this is usually carried out by the circulation of the liver and the metabolism of amino acids and nitrogen compounds. So there's a pathway by which it carry out this transport is known as the glucose alanine circle, and this is where the ammonia ions are transported from the muscle cells to the liver in form of alanine. So there's a process by which it's produced in the body. This is called the transamination, and this is usually the first step, followed by the deamination. So basically, transamination is when the amino group is taken from amino acid and keto acid, whereby deamination is like the opposite. This is when the amino group is taken from the amino acid and other molecules. In this case, instead of the keto acid, is from amino acid and other molecules. So transamination work first, then it leads to the deamination. It also leads to the catabolism of amino acid that convert essential amino acid to non-essential amino acid. Ammonia is excreted in the body when it's converted in the urea in the liver. That's when we excrete it out in the body. And the amino acid we transaminate to form glutamate amino acid. The glutamate will pass through oxidation, deamination to form ammonia synthesis of the urea. Then it is excreted from the body. The enzyme glutamate dehydrogenase function to catalyze the reverse conversion of glutamate to alpha ketoglutamate and ammonia. But glutaminase enzyme function to catalyze reaction of glutamine and water to give glutamate and ammonia, while glutamine synthesis catalyze the reaction of glutamate, ammonia, and ATP to form glutamine. So another question is, how is nitrogen transport connected to gluconeogenesis in the fasted state? Talking about the nitrogen cycle transport here, nitrogen is connected to gluconeogenesis in the fasted state by depletion of carbohydrate source. Then amino acid is going to be used for gluconeogenesis. So in the fasted state, glucagon will cause the liver to transport glucose during gluconeogenesis and synthesizes to form oxaloacetate and glycerol during gluconeogenesis. So since the glucose alanine cycle, that one transports ammonia from the muscles to the liver. In this sequence, the amino group to alpha ketoglutamate to pyruvate and then to glucose. The last question for this case 1 is in this individual, the orotic acid levels are elevated. So what urea cycle enzyme is most likely deficient, and what urea cycle enzyme is least likely to be impaired, and which amino acid, if any, becomes essential as a result of this deficiency? Looking at the results for the blood test for this newborn child, the typical deficiency that is happening to this girl is called ornithine transcarbamylase deficiency, also known as the OTC, because the elevated of orotic acid levels. So the most likely deficient enzyme is going to be ornithine transcarbamylase deficiency, because this disease is quite common in the urea cycle disorder. because it's inherited in the X-link recessive trait, meaning it's most likely to affect guys more than girls, like males more than females. So carbamylphosphate also, this one accumulates in the mitochondria and the leak into the cytoplasm. Then it is redirected to pyrimidine, resulting to high level of orotic acid in the urine. And these enzymes that are least likely are the arginase, agenosuccinate synthesis, and agenosuccinate. So the amino acid that's going to become essential because of this deficiency of OTC will be arginine, because OTC deficiency leads to deficiency of citrulline production, and this also leads to deficiency of the urea cycle and the production of amino acid arginine. So going to moving to the case 3. Here is about a 47-year-old man that was present with severe pain in his right great toe. He's unable to bear weight on his right foot, and there was no apparent trauma. So he reported that the pain started last night and continued. So based on the exam and the laboratory finding, was diagnosed with gout. And here, these are the test results. Here, as we can see, the two tests that were run on this 47-year-old man is the plasma urate and the urinary uric acid. So the normal plasma urate is supposed to be less than 7, but here is 10.5, so that's very high. And for the urinary uric acid, the normal is supposed to be 413 plus positive or negative 78, but here is 215. So the urinary uric acid is low and the plasma urate is high, so something is wrong. Here we have like 3 deficiency disorder. So between these 3, I'm gonna tell you which one leads to gout in this man. So first is the overproduction of purines, second is decreased salvage of purines, and third is decreased urinary excretion of uric acid. The one is most likely that caused gout in this man is the decreased urinary excretion of uric acid. And the reason is because just based on the result carried out here, it shows us that the causes of gout in this man is the decreased urinary excretion of uric acid. And the reason why these remaining 2 are not really consistent, I'm going to tell you why. First of all, gout is a form of arthritis, inflammatory arthritis that usually occurs in middle-aged men and women of menopause. They can occur in anybody, but it's usually occurring in those kind of age category, and sometimes it's usually happen like on the big toe, big great toe. So sometimes you might have symptoms and you might not have symptoms, and sometimes you have certain symptoms of gout. So there's no really cure for it, but there are medications that you can use that can manage this pain, and they can control, not prevent you from the risk of having gout. So since we already know it's decreased urinary excretion of uric acid based on the test, and showing that the plasma urate is high and urinary uric acid is very, very low, so this is wrong. For overproduction of urines, if it's overproduction of purines rather, the plasma urate is going to be high as well as the urinary uric acid. So it is not overproduction of purines. It is not the cause, and they are not really produced in the body. They are produced from excess fructose consumed. So this is crossed out. For the decreased salvage of purines too, if it was this one, the plasma urate is going to be high as well as the urinary uric acid. And this one also, this disorder usually leads to inhibition of purine metabolism. So more blood tests is going to be required before we can decide on the first 2. So we found this one about this one. Then after discussion with this patient, he tells you that he recently switched from diet soda to regular soda, and he drinks like 4 to 5 liters of soda per day. So what is the potential impact of this dietary modification on the presentation of gout? Normally, soda contains fructose, and any sugary beverage always contains fructose, and this man takes like 4 to 5 liters per day. So when these fructose are consumed in the body, they are converted to purines and they are further converted to uric acid. So this will increase the uric acid levels, and when these uric acid levels accumulate in the body, this is what causes the clots in this man. Some seafood like meat or beer can also contain purines that will increase the uric acid level in the body. So medication like steroids, allopurinol, or some NSAID can be used to manage gout. And also diet that are rich in vitamin C can also increase renal excretion of uric acid, and it can also reduce to prevent gouts. And some other food like coffee, like fruit and vegetables, can also be used to like manage gout. Thank you for listening.